Good morning. Always nice to see you here on 3+U. Wasn't it a treat to wake up to yet another beautiful day here in the Tennessee Valley? I don't know about you, but I was outside enjoying it yesterday. Couldn't wait to go for a walk around the neighborhood, and it seems like the more exercise I do these days, the more my body can kind of pay for it later. So it's a good time for us to have Dr. Doug Stidham on the show. He is with the Disc Centers of America-Chattanooga, helping us ease those back and neck pains. Good to see you this morning.
It's good to be here. Thank you.
I'll have a question before we talk really about what you get into specifically at Disc Centers. Stretching and preventive care, is it a really important part of our lives as we get older?
Preventive care, absolutely. The old phrase, an ounce of prevention is better than a pound of cure.
Yeah.
That rings true with me. Stretching, I'm a big fan of stretching after an activity. I think that's the best time to do it so we can avoid micro tears and injuring things.
So it's amazing what those of us who are lay people don't know about the body and how it works. So you brought a prop with you this morning because anybody watching today who's dealing with just that ever so often nerve pain that can hit in your back, even your shoulder, you know it hurts, but you don't know really what it is. You can kind of show us in a way, can't you?
Yeah, I use these in my office to educate my patients because I feel like I'm a visual learner, so it helps my patients. There's different kinds of pain, and nerve pain, it can be compared to like a toothache. That tooth is connected to a nerve, and when you have a toothache, you know it, and you're going to do anything with your schedule to get that fixed.
Because you can't get away from it, it's constant.
But like a tooth you can see in the mirror. Every time you smile, it's there, you can see it. The spine, we need a visual because it's so deep within us.
Right.
And it's deep because it's important, and it's surrounded by bone, encased in bone, because that system is one of the most important in our bodies.
Okay, so I'll throw out some terms.
Okay.
And then I'm guessing it'll land with at least a lot of people out there. So a bulging disc, is that a common complaint people come to you for?
Yes, and that's more of in the early stages. When people have or complain of a bulging disc, you hear things like, my back has just gotten tight, it's always tight, or after I stand up from sitting for too long, I have to kind of slowly get to where I can fully stand up.
Yeah.
Have you heard those things?
I've experienced those things.
Yeah.
So that's a warning sign?
That is a warning sign that it's affecting the muscles in that area in a way. So it's not necessarily the muscles, it's what's controlling those muscles.
So your prop, can you show us what a bulging disc looks like?
So these are the bones, these are the vertebrae. This is like one relationship in your spine. It houses and protects the spinal cord, and then at each level where the disc is, there are two nerve roots that come off. And depending on what area of the spine you're talking about, it goes to a different organ system, it goes to a different set of muscles. When we have a bulge, it can look a lot like this right here. And see, it'll push that water from inside the disc inside and right onto that nerve root, and that's where we start to deal with those problems.
Okay, so does that mean then that if I have a pain, I'm going to just pretend that the nerve shooting goes down my leg?
Okay.
So I might think that my leg has a problem. The truth is the origin of that could be in my spine and the nerve it's hitting.
Yep.
Is that the idea?
See it 100 times.
Okay.
So people will complain of tight calves. And they're like, I haven't done anything to my calves, and I actually walk and take care of myself and exercise. Why are my calves so tight? Well, that actually is a clue for me. If you look at a dermatomal chart, which kind of shows you where the muscles are compared to where the nerve distribution is, it paints a picture. These are clues for doctors like myself to let us know what area of the spine we need to be looking at.
Okay, so does one thing lead to another? A herniated disc. Does that result from not treating a bulging disc, or is that caused from something different?
It depends on the severity. Former athletes that have, I say abused their bodies, but maybe just didn't take care of their spine the way they should have for doing those types of athletics. Those chronic conditions can turn into something. The disc, something people don't know about a disc is that there's no blood supply coming and going. So there's no good, fresh oxygen and taking the toxins away. It's just water, and it relies on that water, just like you and I do, Julie, to stay healthy. And if there's a tear in those cartilage fibers and that water is starting to get out, that unit is literally dying of thirst.
It doesn't replenish.
It doesn't. It has to be restored.
How do you restore it?
That's where we come in. Disc Centers of America, we focus on non-surgical spinal decompression. I'm a chiropractor by trade, and I love getting adjusted. I love adjusting my patients, but there is no adjustment that will fix a herniated disc. or a bulging disc. You actually have to decompress it. So with the technology we have in our office, we can create this vacuum. By the way we put the patient on the table, in the position that their legs and body is in, and how we get them relaxed, and then it provides the perfect amount of pressure at the perfect angle, because there is a curve in your back. So if we're working on a different disc, we have to augment the table's pull to be on a very specific disc. It doesn't just pull north to south.
Right, okay.
That's traction.
Gotcha.
Traction is oftentimes gets confused with spinal decompression.
Okay, so it's one thing if someone's watching today and they've got these aches and pains, and by the way, you'd help with more than herniated discs and bulging discs. What are some other things that you see?
Sciatica, just that radicular pain that people they come in and say, my sciatica is active, it's just really bothering me today.
Shoulder pain?
Yeah, shoulder pain, neck, disc, they both are very, very similar because there's a curve in your neck too, so we have to augment those angles. The harder discs are the ones in the thoracic cage, like T1 through T12, but the neck and the lower back, we can decompress any disc in those areas.
Okay, so if somebody's had an injury or they have this active pain now, you can hear him saying that his whole goal is to help you avoid surgery, and they do this every day to set you on the right path to hopefully get you feeling better.
That's
and you
right.
don't have to go under the knife. For people who are not yet feeling pain, but they're like me, they're exercisers, they're just getting older and living their life. Is it a preventive treatment to come in and do too?
I tell people it's lack of movement of your spine that causes the disc to dehydrate and start to become more brittle. Okay. Imagine a sponge. Two sponges that are the exact same, one's dried up and one is moisturized, one's hydrated.
Yeah. They're
different heights, right? So when people talk about they have disc degeneration, well, what if you just pulled the water out of that disc?
You are a visual learner.
You pour water on that sponge and it puffs back up.
Yeah.
So it's not game over for you if we just determine that it's smaller. It could just be dehydrated.
Right.
So if we pull drops of water back in, what's going to happen? We can restore that.
It's a fascinating conversation to have, I think, because once you understand the science behind it and the anatomy behind it, it makes so much sense. And then you can then empower your life. So here's how you can get in touch with him. It's Disc Centers of America, Chattanooga on East Brainerd Road. 423-580-4280 is the phone number. ChattanoogaDiscCenter.com. If they want to make an appointment, should they call or do they do it online?
Your best bet's to call that number and talk to Jessica.
That's a great answer. People like it that way. Thank you so much for being here.
Hey, thank you for having me. I really appreciate it.
It's really a pleasure. We're back after this.
We've enjoyed it.